I want to come back to Dr. Nobel and the UnLonely Project. So much of the work that the UnLonely Project focuses on is social connection. And on your website, you cite a study that says that loneliness is as lethal as smoking 15 cigarettes a day, which is a very eye-opening stat. What can people do now to be unlonely, Jeremy, and create human connections even during these shelter-in-place orders?
Thanks, Eli. Great question. And that stat about loneliness being as lethal or increased risk of early mortality for many people as much as smoking 15 cigarettes a day certainly gets a lot of attention. Let me be clear that that is not because of suicide. That's not because of drug overdose. It's because loneliness actually increases inflammation. It reduces immune system response. And so these excess deaths are cardiovascular. They're from diabetes. And and these are problems obviously having nothing to do with mental health challenges. So for even more reasons than many people are aware, we have to address loneliness. And that really has been the focus of the UnLonely Project for 4 years now. Now, in the Corona times, the key to addressing loneliness is to share something authentic about yourself with someone else, thoughts and feelings. We do that in a variety of ways, but people don't need to use technology to do that, or high-level technology. They could do it through simple phone calls. They can even send old-fashioned letters. Or in Italy, they can sing from the balconies of their apartments. So there's no reason, even though we're physically isolated, that we can't share the authentic feelings and thoughts that allow us to feel meaningfully in touch with other people, understand their concerns, understand what is troubling them, share our concerns, share what's troubling us, and through that forge the authentic connections that push back against loneliness.
Thank you very much for that. So I do want to come back to Darcy. And so Darcy, there's been lots of messaging lately around connecting with a mental health professional, if you feel unwell. So if someone is feeling anxious, unwell, and they want to connect with a mental health professional, how does one actually go about doing that? Where does one start? And how do they go about seeking professional support? And equally important, how can family members or friends help encourage or facilitate someone getting support if they need it?
Yeah, I think this is a great question, and it really builds on what Marjorie mentioned earlier, which is the mental health field is complicated. And there are a lot of different types of providers, and they can all be very difficult to access. But I would say the answer to the question is it depends on the level of severity. So if you are experiencing sort of mild or moderate, just experiencing the beginning stages of anxiety and just not feeling right, you can certainly consider connecting with the EAP. EAPs have counselors on staff. They're trained professionals. That is an important place to start because for some people, it may be enough to have a meaningful, connected conversation. And it may help them to feel less anxious. The counselor could provide them with some strategies around things to try to really quell and quiet a little bit. They can help normalize what people are experiencing because many of us are experiencing excessively high levels of uncertainty, stress, anxiety. So the EAP, again, is one option. The other thing is to check in with your primary care provider. If it's less serious, if it's a mild condition, primary care providers can be an important referral route for people. They're also very quiet right now. They're not getting a lot of patients. So calling the office to see if you can speak with your provider to share what you're experiencing is a good place to start. Many people get treatment in primary care for mild to moderate depression, anxiety, substance use, trauma. Then also the other thing the primary care provider can do is they can suggest referrals to specialists. The other option is to go to your health plan and let your health plan know that you're looking for an in-network mental health therapist or psychiatrist. This is particularly important if you are experiencing something on the more kind of severe to, moderate to severe side of things. And the challenge there and the big caveat is most health plans do not have enough in-network providers. And it's often it often happens that people will call providers on their health plan in their health plan's network list and find out they're not accepting new patients. They have a 3-month wait, or they don't take insurance. So that's a big challenge. And if that happens, employees should strongly consider letting their HR benefits lead know, because we need more employers to get active in working with health plans to build their networks, because we know that there's a huge need there. So if employees feel comfortable, I know there is a concern around negative job consequences if people disclose they have a mental health condition. So that can complicate things a bit. But I really do think, as someone said earlier, we are seeing somewhat of an opening up and a willingness at the highest levels of organizations for leaders to talk more about how much mental health is being stressed during this pandemic. And then just turning to encouraging people, family members or friends, to seek help. It's very important to really start with I statements if you're worried about someone, and really let them know what you're seeing. So you might want to say, I'm seeing a family member or friend, I'm seeing that you're sleeping a lot, you're not doing the things you previously enjoyed, you're not connecting with us socially, although you did often before, and I'm concerned about you. The key too is to lead with empathy and compassion, because this is difficult. Mental health is still a taboo topic that people aren't necessarily comfortable with. It's really important to be a good listener and resist the temptation to jump in with a solution. So you really want to listen and hear what the person has to say and let them get through everything they're experiencing. It's really helpful to normalize that and express understanding that this is something many people are experiencing. You don't want to minimize it because it's something they're living with and it's challenging, but you do want to let them know that it's okay, that it's a sign of strength to get help, to offer to go with them to get help if that would be something they would value. And the other thing is, if they say absolutely no and you get a firm kind of I'm fine, I'm not interested, and you're still worried about the person, don't let that close the door. Check back in and check in a few days, and just let the person know that you care and you're concerned about them.
Thank you for that, Darcy. Really appreciate that. I know I'm guilty of jumping of solutions, and I know I need to listen a little bit more. So I really do appreciate that feedback. And also, hopefully through this, there'll be a greater recognition of the fact that we all have mental health that we need to take care of in ourselves. And hopefully we'll start breaking down some of those barriers to these conversations that need to be had. So thank you very much for that. I want to come back to Marjorie. So we've talked a little bit about Psych Hub and the fact that you're offering an incredible collection of resources for individuals, professionals, and others that they can tap into to get that mental health support that they need. Wondering if you can actually spend some time talking us through those resources exactly, give us a little bit more depth in terms of what you've developed for families, professionals, teachers, and others. And just curious, which resources are you finding are the most in demand right now? I think you had mentioned one of those resources earlier in terms of panic, but wondering if you could highlight some of the other resources that you were seeing folks tap into.
Yeah, thanks for that question, because it allows me to talk about my favorite subject, Psych Hub, and our resources. But I appreciate that I get a piggyback on really what Darcy's talking about, because you just hear that myriad of issues of the different ways that you got to go find help. And I think that that was such a comprehensive list that she gave. And then the one other thing I would add to it is that self-care piece, because for that, and the way she set it up was so perfect too. It's a lot of times it's the family members or the closest friend that recognizes that something's not quite right with someone that they're close to, oftentimes more than you notice it yourself, and I think about this a lot of times, if you're having a tough time, it's not when you're in it that you always realize it. It's a lot of times when you get out of it and you think, God, I was really depressed during that time. So we really need all those people around us to do it. And the way she talked about the I statements, it's so important, because when you do that, now that person's not feeling defensive. It's coming from the other person saying, I'm feeling sad when I watch you do this or whatever. It comes from an empathetic place. So we took that same kind of baseline, and with we have a triangle of how we look at the different types of resources for different populations. The bottom of the triangle is everybody, right? And that's when we talked about earlier, informed consumers. And that's a huge amount of information that's needed, and it's different for everybody. So some people need to understand, what is depression? There's so many different types of depression alone. Most people don't understand that. So Psych Hub has over 150, I think it's actually 182 at the moment, micro videos. They're all under 4 minutes. They're animated, even though you would think it's just a few minute animated video, must be easy to produce. We go through painstaking work, both on the content side of it. We have clinical QA at 11 points in any 3-minute video. And that's psychologists and psychiatrists. We have a system where anytime that we reference something, but we've mulled it down again and again and again to get it to this very edited version of 2, 3, 4 minutes to give people exactly what they need to know about what a symptom is. So it could be sleep. You asked about what are some of our most popular ones right now. Sleep is a huge issue. Panic attacks, that was the one I mentioned earlier. We also developed a whole bunch around COVID, just the typical types of stressors of what to expect. And what you'll see in a Psych Hub video, very much piggybacking on this, is almost every video starts with 4 different scenarios. So a person talking about their own experience, because no single experience is the same, but we try to hit it from different angles. So in a COVID one, we talk about, I go out and I'm feeling anxious. I'm just going to the grocery store to pick up groceries and I'm anxious. I'm going to catch something. Or what if I cough and everybody looks at me? So we do these vignettes and then we go into really what those symptoms are. A lot of our videos are self-care, giving you specific tips so that for someone who might not want help, but to go out and access it externally, that there are some things that they could do for themselves. So we have a series, they're all free. So I think that I highly recommend you come to our site. You can access them that way. We do have over 600 partners. They have the videos, they share them. So if it's an organization or a company we're not partnered with, we just give them the videos. But please take advantage of them because they're such a vast library and it's growing every day. We just released 2 new ones today. And it takes us 3 to 4 months to develop them. But then we also have learning solutions, and those are for employers and providers and the medical community on actually how to do more strategic interventions, having a more precision approach to how they handle behavioral health. And those are really cool because they're not only teaching through multiple types of mediums, role plays and fireside chats and animations and games. But once somebody learns, an employer or provider, how to treat effectively, they get access to a whole library of videos for their clients. So even if it's a faith leader, if they're doing an intervention around CBT, cognitive behavioral therapy for anxiety, we have a whole library of videos for them to share with their client about activities and exercises that they're doing in those types of sessions, putting a framework around what to expect. Because part of it too is it's very daunting for someone to go into therapy and not know what to expect. So we have a lot of resources, so I hope people will take advantage of them.
I do too. Thank you very much for that. And we'll make sure that through the distribution of this video that as many folks become aware of Psych Hub as possible. So thank you, Marjorie.